to follow to help protect the BAME community from COVID-19. Step 1. Washing your hands. Wash your hands with soap and water or use hand sanitizer regularly throughout the day. You should wash your hands after coughing, sneezing, and blowing your nose, and before you eat or handle food. Wash your hands after coming into contact with surfaces touched by many others, such as handles, handrails, and light switches, and shared areas such as kitchens and bathrooms. When possible, avoid touching your eyes, nose, and mouth. If you do need to touch your face, wash or sanitize your hands before and after. Why hand washing is important? Hands touch many surfaces and can become contaminated with viruses. Once contaminated, hands can transfer viruses to your eyes, nose, or mouth. From there, viruses can enter your body and infect you. If you are infected with COVID-19, you can pass the virus from your nose and mouth to your hands and infect the surfaces that you touch. Washing or sanitizing your hands remove viruses and other germs, so you are less likely to become infected if you touch your face. Using soap and water is the most effective way to clean your hands, especially if they are visibly dirty. Hand sanitizers can be used when soap and water is not available. Step 2. Clean your surroundings. Clean surfaces often pay particular attention to surfaces that are touched frequently, such as handles, light switches, work surfaces, and electronic devices. Why cleaning your surroundings is important? COVID-19 spreads through small droplets. Aerosols and direct contact, surfaces and belongings can be contaminated with COVID-19 when people with the infection touch them or cough, talk, or breathe over them. Let fresh air in. Let fresh air in so that viruses can remain suspended in the air for some time indoors, especially if there is no ventilation can be cleared. Step 3. Cover your nose and mouth when you cough or sneeze. Cover your mouth and nose with disposable tissues when you cough or sneeze. Why coughing your nose and mouth when you cough and sneeze is important? Coughing and sneezing increases the numbers of droplets and aerosols released by a person, the distance they travel, and the time they stay in the air to stop the risk of infecting others around you. Is by law in all public places. You should also wear a face covering in indoor places where social distancing may be difficult and where you will come into contact with people you do not normally meet. Wearing a face covering may not be possible in every situation or for some people who are exempt. Please be mindful and respectful of such circumstances. Step 4. Social distance. Minimize contact and save lives. To slow the virus, we will need people to reduce unnecessary social contacts. Stay at least 2 meters away from others outside your household or support bubble. Reduce the time spent in crowded areas where it may be difficult to socially distance. Avoid direct contact and face-to-face contact with people you do not live with. If you live in the same household as someone who is clinically extremely vulnerable, try to stay 2 meters away from them even when you are at home. Stay at least 2 meters away from anyone who visits your home for work reasons doing essential or urgent work. You can spend time in outdoor public spaces for recreation on your own, with your household or support bubble, or with one other person. This means you can sit down for a drink or picnic. You must continue to maintain social distance from those outside your household. This is in addition to outdoor exercise, which is already permitted. Step 5. Self-isolate. Self-isolate if you have COVID-19 symptoms. Self-isolation means you must stay at home at all times and not have contact with other people, except in very limited circumstances. You may have to ask others to do your shopping, and you may have to make alternative plans if you are currently supporting a vulnerable person. Do not invite visitors to your home or garden. Self-isolate immediately and for the next 10 full days because this is the period of time when the virus is most likely to be passed on to others. Get tested if you still have symptoms after 10 days to know if you have COVID-19 so that you stay at home, self-isolate, and do not infect other people. Step 6. Free regular flow lateral test. Lateral flow device testing is a fast and simple way to test people who do not have symptoms of COVID-19, but who may still be spreading the virus. Around 1 in 3 people with COVID-19 do not have symptoms, so a test that rapidly detects these otherwise hidden cases is a very useful additional tool for tackling the virus. Lateral flow tests are practical, easy to interpret, and can be used in a wide range of settings. This makes them ideal for widespread use in the community. In different councils around London, free lateral flow tests are being held. If you go to work, make sure to get the test regularly for early detection.